Welcome to WellNerd, your weekly dose of science-backed wellness made simple. Ever felt your heart skip a beat, flutter, or start racing out of nowhere? The host reassures that's what we call heart palpitations. And while they can feel terrifying, most of the time, they're harmless. The host breaks down what causes these odd heartbeats, and when it's time to actually worry, you might feel pounding, fluttering, or like your heart is flip-flopping in your chest. Sometimes it skips a beat, or adds an extra one. The good news? Most palpitations aren't dangerous. But let's explore the common triggers. The host explains the first trigger: stress and anxiety. When you're anxious or having a panic attack, stress hormones surge, speeding up your heart rate. It's your body's survival mode, even if there's no real danger. Number 2. Exercise. The host says your heart naturally races when you work out, which is healthy. But if you're out of shape or have an underlying condition like arrhythmia, you might feel palpitations more intensely. Number 3. Caffeine. The host notes that your morning latte is a stimulant that can speed up your heart, though studies say coffee, tea, and chocolate don't usually cause issues unless you already have heart rhythm problems. Number 4. Nicotine. Smoking or even using nicotine patches can trigger palpitations. The host encourages quitting, but warns it can take weeks for your heart rhythm to settle. Number 5. Hormonal changes. The host reassures that periods, pregnancy, and menopause can mess with hormone levels and cause your heart to beat faster. Usually, it's nothing serious. Number 6. Fever. A high fever burns energy fast and can boost your heart rate, especially above 100.4 degrees Fahrenheit. Number 7. Medicines. The host cautions that certain drugs like asthma inhalers, cold meds, diet pills, and even thyroid or high blood pressure meds can cause palpitations. They advise not to stop them without talking to your doctor. Number 8. Low blood sugar. The host says if you skipped a meal, that shaky, irritable feeling is often low blood sugar, which can make your heart race as your body releases adrenaline. Number 9. Overactive thyroid or hyperthyroidism. The host explains that too much thyroid hormone revs up metabolism and causes a faster heartbeat. Number 10. Heart rhythm problems. The host states some arrhythmias like AFib, supraventricular tachycardia, or ventricular tachycardia cause frequent noticeable palpitations that require medical attention. Number 11. Alcohol. The host notes, holiday heart syndrome is real. Drinking more than usual, even a little, can mess with your heartbeat. Number 12. PVCs, or premature ventricular contractions. These are extra heartbeats that throw off your rhythm, harmless in most people but concerning if you have heart disease. Number 13. Street drugs. The host warns that drugs like cocaine, ecstasy, and amphetamines are major heart hazards, spiking heart rate, blood pressure, and risk of damage. The host reassures that palpitations now and then are probably no big deal. But call your doctor if you also experience additional symptoms. Doctors can pinpoint the cause using tests like ECG and Holter monitors. These tests help track your heartbeat and check your heart structure. The host encourages that heart palpitations can feel scary, but understanding the cause helps take away the fear. They invite you to like, subscribe, and turn on notifications for more wellness science every week. Finally, the host, Prometheus, signs off warmly. Stay curious, stay well. This is WellNerd.